Hello everyone. Good evening. I'm Steve from UCAN English Tutoring. In this video, I'm going to share one of the letters written by my students for the recent case notes that were asked in the real OET examination on the 12th of June. Let's go through the case notes first and then I will assess my students' letter. All right, so you'll get this one: writing subtest, nursing. Time allowed, reading time 5 minutes, writing time 40 minutes. Read the case notes and complete the writing task which follows. Assume that today's date is 12 June 2021. You are a registered nurse working in the emergency department of St. Patrick Hospital, 390 Victoria Street, Braehead, Darlinghurst, UK. Okay, notes. Name Mrs. Sylvia Rule. Date of birth 6 June 1952, that is 69 years. Address Wellcare Nursing Home, 42 Darlinghurst, UK. Next of kin, two daughters and three sons live near. Social history: occasionally smokes and drinks. Mother 90-year and father 99-year stays in a nursing home. 10 March 2021, breathing difficulty, fever, fatigue management, treated with antibiotics and discharged after 1 week. Medical history: hypertension, dementia, diabetes. 16 April 2021, high temperature, high blood pressure, breathlessness, chest infection, possibly due to pneumonia, management, treated with oxygen and antibiotics. 10 June 2021, presenting problems, brought by ambulance, wheezing, shortness of breath, crackles audible, fever 38.9 degrees Celsius, cough, fatigue due to pneumonia. Investigations: X-ray, blood screening, complete blood, CT scan. Diagnosis: bacterial chest infection or exacerbation of previous illness. Pneumonia ruled out. Management: oxygen through face mask, given injection amoxicillin 500 mg into 3/day. Patient became reluctant and became aggressive, shouting and restless for ward admission. Diagnosed with Alzheimer's. Discussed with the family and advised instant discharge. 12 June 2021. Fit for discharge, fever in range of 37.4 degrees Celsius, wheezing and SOB reduced. Tab amoxicillin 500 gram into 3/day to continue for 1 week. Nurse to monitor fever, SOB, fatigue, check medication. Plan: transfer to nursing home. Writing task: using the information in the case notes, write a letter of information to Miss Dobson requesting care and monitoring for Mrs. Sylvia. Address the letter to Miss Julia Dobson, head nurse at Wellcare Nursing Home, 42 Darlinghurst, UK. In your answer, explain the relevant case notes into complete sentences. Do not use note form, use letter format. The body of the letter should be approximately 180 to 200 words. All right. So when we go through these notes, we should be able to find out that this is a known case. All right, this is definitely a known case because the residential address for the patient is going to be the same as that of the nursing home where she is going to be, discharged back. All right, so it is a known case for this particular letter. So you don't need to include any social or the medical background, I mean medical history prior to her admission. Okay. All right, let's go through the way my student has written down the letter. All right, so my student has written down the date on the top, that is 12 June 2021. That's good. And then she has written down the addressee's contact details, that is Miss Julia Dobson, the head nurse, Wellcare Nursing Home, 42 Darlinghurst, United Kingdom. She has done a wonderful job by writing down all these details without any spelling mistakes. Okay. And then when you go to the salutation, she has used dear Miss Dobson, comma. So it's good. She used the correct salutation, the correct prefix, and then the correct name after that as well. I'm happy with that. She has written on the reference details of the patient after that. It is regarding Mrs. Sylvia Rule, comma, aged 69. That is perfect. Let's go through the introduction paragraph. I'm writing to update the current status of Mrs. Sylvia Rule, who requires continuous care and further management. That's a full stop. That's a very good sentence structure. That's a good complex sentence. So she has written down a wonderful sentence in the beginning of the introduction paragraph. She has been recuperating from pneumonia. She is being discharged today. That's perfect. So this introduction paragraph doesn't have any grammatical mistakes. Well done, Vanati. You have done a wonderful job. Let's go through the next paragraph. Mrs. Rule was presented to our hospital a couple of months ago with the complaints of difficulty in breathing and fever, for which she was treated with an antibiotics. So you have committed one mistake here, because an goes only with the singular noun. It should be an antibiotic medication. Okay, so that is one of the major mistakes that you have committed here, but apart from that, it was okay until now. All right, so it should be an antibiotic medication. Antibiotic medication, because it's a singular noun, so you need to be a bit careful about that. All right, let's continue there. On subsequent days, comma, good, you were able to place the punctuation marks correctly. She had developed severe breathlessness and increased in temperature, possibly owing to chest infection. Unfortunately, it's not increased in temperature, so you should have written down either increase in temperature, otherwise increased temperature. Okay, you should use increased temperature. I think that would be much better. All right, so you could have written down, but you didn't do that. You shouldn't have used this preposition over there. All right, let's go through the next one. Owing to chest, possibly owing to chest infection. Good. Hence, she was recommenced on antibiotics along with the oxygen administration. Perfect. So this is a very well connected paragraph, and you have clearly stated the information in a well organized manner. The only things you have done by mistake was the use of improper noun in here. All right, and then this one, improper verb. Apart from that, it's good. You shouldn't have used this preposition, otherwise it's good. All right, Mrs. Rule was brought to hospital by ambulance 2 days ago with definitive features of the aforementioned diagnosis. On examination, comma, she was febrile. In bracket, you have written on the temperature, that is 38.9 degrees Celsius. Awesome. Consequently, crackles and wheezing sounds were audible by auscultation. Good. The X-ray, computerized tomography, and certain blood investigations were performed for her. All the reports revealed bacterial chest infections due to exacerbation of previous illness. Okay. So instead of writing down the X-ray, computerized tomography, and certain blood tests, you could have mentioned, instead of writing down the X-ray, you could have mentioned an X-ray. An X-ray. All right. Instead of saying computerized tomography, you could have used a computerized tomography. All right. Apart from that, this one is good. Okay. And certain blood investigations were performed for her. All the reports revealed bacterial chest infections due to exacerbation of previous illness. That's good. During hospitalization, Mrs. Rule was supported with oxygen via face mask. Also, amoxicillin injection 500 mg for 3 days has been, let me go to the next one, has been prescribed to her. In addition, she became reluctant, aggressive, and restless in ward. After certain assessment, there should be a comma. After certain assessment, there should be a comma over there. After certain assessment, you should place a comma here. Place a comma after assessment. Okay, I'm happy with that. All right, let's go to the next one. Okay, after certain assessment, she was newly diagnosed with the Alzheimer's disease. I'm happy with that. That's good. That's a good sentence structure. In view of the above, it would be highly appreciated if you could monitor Mrs. Rule's respiratory status, temperature, fatigue, and medication regimen. It is worth mentioning that her antibiotic injection is switched to amoxicillin tablets, 500 gram. That's good. Thrice a day for a week. Her respiratory function is stable. Today, comma, she will be transferred to your facility. Perfect. So the way you have written down this paragraph is amazing. So your writing skills have been improved a lot. I'm very happy that you have been on the right track now. Especially you're going to appear in your examination in 2 days. So I'm pretty confident that if you write like this, you are going to smash the examination with at least 350 in the writing section. Should there be any further questions, please do not hesitate to contact me. That's good. You are sincerely the registered nurse, because you do know the address, the name of the address to whom you're writing. So that's good. All right. I'm very happy with the way that you have been writing down. Let me give you the assessment now. All right. So one, grammar is up to the mark in most part of the letter. So I'm very happy with that. Okay. Use of nouns, verbs, and articles. Okay. Plus the punctuation marks could have been bit better. Punctuations and articles could have been bit better because you have committed a few mistakes, although the overall grammatical accuracy is really good enough. All right. Okay, connectivity is great. Connectivity is great. Vocabulary is perfect. Vocabulary is perfect. Overall task fulfillment, overall task fulfillment is perfect as well. All right. Okay. Um, you have used a range of sentence structures with the ease. It was awesome. Definitely, this letter is going to be a treat for the reader. Although you have committed a few grammatical mistakes, they can be overcome because they are not the major ones anyway. So you could have identified them previously as well. All right. And what else? I have already checked that you have included all the relevant case notes. I'm very happy with the way that you have included. All relevant case notes were included. Well done. Because this is a known case, so you didn't include the social or the medical background. You have included only the information from the time of admission until now. So it's really good. I'm very happy with the way that you have worked out on this. Use of passive voice form was absolutely exceptional. I'm very happy with the way that you have done this. All right. Um, Overall task fulfillment is good as well. All right. Just give me a minute. Okay. Yep. All right. Overall task fulfillment is good. Use of sentence structures is good as well. And connectivity is at its best. I'm very happy with that. So what you have done, yeah, so it's almost done. So you have done a good job. Layout and presentation features are also good enough. Layout and presentation features are good enough as well. So you have done a wonderful job. You were able to use polite phrases. You were able to use you have used a range of synonyms as well. I just had a look at them. So it's good. Instead of using the same phrases, you have done a wonderful job by using the synonyms. According to me, this sounds like a, okay, let me go back and check out the number of mistakes and their severity. Well, and antibiotics, that's one of the mistakes. Number two is also a mistake. Number three is not a mistake. It is still okay. You could have used an X-ray, that's all right, or the X-ray, that's fine. And number four is a mistake. Number five is not that important. Looking at all the other points and the severity of these mistakes, I'm still happy to give you at least 360 out of 500 for this letter. Congratulations, you have done a wonderful job, Vanati, by writing down another B grade letter for the recently asked OET writing subtest question. I'm very happy that the way you have been writing down has been improved dramatically. And if you write like this, you are going to crack the examination in the upcoming attempt itself that is going to be held in 2 days. All right. Thank you so much for watching this video. If you would like to get your first letter assessed at free of cost with utmost accuracy, may I request you to send me your email, send me your letter to my WhatsApp or mobile number, that is +614684808877. You can also send it to my email address as well, that is steve@ucanenglishtutoring.com, along with its case notes. You will be able to receive the high quality assessment. You can also stay tuned to my Facebook page by liking www.facebook.com/ucantutoring. I offer high quality and proven courses online. If you are struggling with any part of the OET examination, you can receive one of the course packages that is going to be suitable to you. Um, Thank you so much for watching this video, and I wish you good luck with your preparation and examination. Have a good day. Bye.